Hi everyone. I wanted to take a minute and address some things that I've been seeing like wildfire today on social media and the news. Unfortunately, there's been a couple high-profile suicides that have happened recently. And when those happen, as we mourn and try to grasp how and why that happened, I think part of the bigger issue that we need to start doing is seeing how we can get this to stop. Part of it is starting to understand what depression is, what suicidality is, and what mental health issues really are. I think that people don't view it as a medical illness. And I want to give you an analogy today that I hope will make a little bit more sense. I don't have diabetes. However, I've had many friends and family members that have had diabetes. And sometimes it's type 1, sometimes it's type 2. It doesn't really matter how or why you got it. However, something that you are responsible for is once you know you have a diagnosis, you're completely responsible for your own care. Part of that is maintaining. Some diabetics have to take insulin. Some have to take shots. Some have to take oral medication. Whatever you need to do to maintain it. And a large part of it is also lifestyle. You have to watch what you eat. You have to be very mindful. You have to regulate a lot of things that other people take for granted. That doesn't mean you're doing something wrong. The fact that you end up diabetic with diabetes, it doesn't mean you've done something wrong per se. It means it is what it is. You have this. And now that you have it, you're the only one that can control the matter of how it goes. It's pretty much how mental health issues are. Some mental health issues are genetically based. Some aren't. Sometimes, if my mom and dad had this, I'm going to probably have it. In that case, I will probably need medication to help regulate whatever chemicals I might be lacking or I have overabundance of in my head, in my body. And in other cases, sometimes it's situational stressors. Regardless, it doesn't matter. The thing that's important to understand is suicide is not about wanting to escape necessarily. It's about people being in so much pain for so long, they don't know how to fix it. They're just sick and tired of being sick and tired. Part of what we have to understand is once you know that you're depressed, when you wake up and wish you were gone, when you wish you could just escape or disappear, that's depression. Part of that is starting to figure out what's going on. What's your thoughts? Whenever you're depressed, guess what? You can't just shake it off. It's just like if I have a loved one with diabetes, oh, guess what? No, here, eat this cupcake. You can just shake it off. It's fine. That's not how it works. So how is telling a loved one with depression, oh, no, you're fine. Just get out of bed and get dressed. You're fine. Just shake it off. The high-profile celebrities that we've seen recently, part of this is these were celebrities that we viewed on the outside as, guess what? They have it all together. They have money. They have a glamorous lifestyle. They can do whatever they want. They can go wherever they want. They also had this big image to maintain. So when they would wake up in the morning and be having a bad day, people don't want to hear, guess what? You have a show to film. People don't want to hear it. Part of this is understanding that it doesn't matter what your lifestyle is. It doesn't matter who you are or where you are. Sometimes things happen. Whenever depression hits, generally there is something chemically going on inside of you. Whether it's situational, whether it's genetic, it doesn't really matter. What starts to happen, so let's say if I have a series of losses in my life, boom, 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 bad things happen, I don't know how to deal with it. What starts to happen is my brain chemistry starts to change. When I have repeated bad things happening, part of my system becomes a little bit overactivated. I'm looking for bad things to happen. And then in response, part of my system stops shooting off the chemicals that I need, or if I'm shooting them off, they're getting reuptake. They're getting taken back up too quickly, so my body doesn't have a chance to absorb them. So if I love puppies, when I see that cute little fuzzy puppy and my brain normally shoots something off to make me feel good, either it's not shooting off or it's not staying there long enough where I can use it. Sometimes when I have chronic stress, that does alter the way my body's producing those chemicals. Sometimes medication is needed to start that. And it doesn't mean that medication's a forever thing for you. It's just something, whenever you're struggling to get out of bed and you're losing hope and you feel that no one cares and no one understands, that's when you do need to reach out to a therapist. You do need to reach out to your doctor. Therapy is profoundly helpful. And I know that sounds silly because people think, well, what do you really do in therapy? It's not really about doing something. It's just about sitting down and talking with someone and opening the door on the stuff that's going on in your brain and starting to figure out what's going on that you do feel so badly, and looking to see if there's a chemical component, if medication, a psychotherapeutic medication, would help to get you back in the right direction. Very much if I have high blood pressure, and for me, if I gain 30 pounds and I have high blood pressure, when I have that weight gain, guess what? I might not need to be on that blood pressure medication my whole life. If I lose that 30 pounds again, I get healthy. I can taper off that medication and be perfectly fine in that case. Some people need medication, some people don't. Therapy, though, is the part that can get you better. Whenever things are bad, I know it feels like there's no escape. I want you to know there's hope. I want you to know there's treatment. The escape isn't suicide. It's not an ending point. It's just passing your pain to someone else. And I know no one wants to hear that. No one likes to think of that, but that's the reality. Things can be better. So what I encourage you to do is when you see someone struggling, please reach out. When you're struggling, please reach out. And I think people get worried a whole lot. What if I say the wrong thing? What if I have a family member and they're telling me they're struggling? I can't ask them if they're suicidal. That's going to make them want to commit suicide. That's wrong. Asking someone, are you going to hurt yourself, does not instill the thought in their head. The thought was already there. If they say yes, then that's something you need to take seriously and get help. If you're feeling that, you need to reach out. You need to get help. It can be as simple as making that first call, that first text. There's a crisis hotline. You can text 741-741. Text the word START to the crisis hotline, and that will get you started with someone chatting with you. The National Suicide Hotline, 1-800-273-TALK, just to get another voice on the phone, to know that you're not alone. You can get through this and life can be better. But if you end your life, it won't be better. I encourage you, if you're struggling, please reach out. Please know it can and will get better. If you have a loved one who is struggling, please reach out to them. Don't let them sit idly and struggle. Don't let them drown in this. Let them know that they're not alone and that you do care. And together, if we start to talk about this and stop pretending, when you have a medical illness, we don't condone someone for being sick. Why is mental health any different? It shouldn't be. I can't change what my brain chemicals are doing. Can you? It's realizing mental health issues are the same as medical issues. They are medical issues. And how we address them is in the same perspective of how we address medical issues. We have to look at the self-care factors. We have to look at the way that we're thinking and viewing it. We have to look if there's a medical component that needs just addressed with medication. But it can be treated. So I implore you today, please reach out, please hold on, and please know it can be better. Take care, and please reach out if needed.